Okay, let's talk about now capillary fluid exchange. Capillary fluid exchange, uh, we have to think about Starling curves. Starling curves determine the fluid movement through the capillary membranes, in which we have the, the capillary pressure, the hydrostatic capillary pressures. So let's just write something here. P would equal the capillary. So this is very important. So P, whenever you see P, you're going to think about a hydrostatic pressure. Hydrostatic pressure. And whenever you're going to think about, let's say this is a pi, you're going to think about oncotic pressure. This is just a terminology. And when you see C, C is going to be the capillary, as the name suggests. And I, easy, I is for interstitial, right? Interstitial fluid or institution. So PC is, they're looking at hydrostatic pressure of the capillary. So capillary hydrostatic pressure is going to push fluid out of the capillary. Okay. And I'll tell you how. I'll make things simple, but just read it here. PI is the interstitial hydrostatic pressure, which pushes the fluid into the capillary. And this pi C, which is the plasma oncotic pressure, which pulls the fluid into capillary. And pi interstitium, which is the interstitial fluid oncotic pressure, which pulls fluid out of the capillary. Okay, so let's just, I'm going to draw this similar thing here, which is here, but I'll just draw it over there. So whenever, wherever we have the PC, so let's say this is the PC, it's going to push the fluid out of the capillary, right? One thing that we talked about. Let's change color. And we said the pi institution, pi, which is in the, I mean, I don't know if it's called pi or something. I'm just calling it pi, okay. Pi institution, pi I or whatever it's called, pi institution is going to take the fluid, it's going to pull the fluid out of the capillary. So look at my arrows, it's trying to pull out the fluid from the capillaries into the institution, right? And then you have the hydrostatic pressure of I, of institution. My bad, this is not pi, this is oncotic pressure, okay? I mean, I wrote it myself here. It is the oncotic pressure. So oncotic pressure of institution is just going to push the fluid out of the capillary into the institution, right? But hydrostatic pressure of the institution is doing the opposite. It's going to push the fluid back into the capillary or into the capillary, right? And again, the oncotic pressure of your capillary would oncotic pressure of the capillary would pull the fluid towards the capillary. So what did we learn? The mnemonic and a good point to learn. We just learned that wherever you will see hydrostatic pressure, it's just going to push it towards the other side. So if you have a high hydrostatic pressure within the capillary, it's going to push it out. If you have a high hydrostatic pressure within the institution, it's just going to push the fluid out to the other side. So either one side is the capillary, the other side is the institution. So it's just going to push the fluid. The word that I'm trying to say is push, right? And what is P? P is hydrostatic pressure. P equals push. That's the mnemonic. So if you have a high hydrostatic pressure in the capillary, it's going to push it out of the capillary, push out. If hydrostatic pressure in the institution is high, it's going to push out of the institution. And the vice versa would occur with the other one, which is so let's just take another pen, let's say black, is the oncotic pressure of the institution. The oncotic pressure is just going to pull towards itself. Wherever you have a high oncotic pressure, it's just going to pull the whole fluid towards itself. if you have a high oncotic pressure in the interstitium, it's going to pull that fluid out of the capillary into the interstitium. If you have a high oncotic pressure in the capillary, that's just going to pull the fluid into the capillary. So again, never forget the mnemonic, which is P equals push, which is the hydrostatic pressure. P equals push, the other guy just going to pull. If you forget the P pull, just remember it's just going to get the fluid in the capillary. Because if you say push and pull, then you will forget. You would not be able to get this mnemonic, which is P equals push. P equals push. Or actually, the other mnemonic could be, you have oncotic pressure. So you can say, it's not inward. So just remember the other guy has no mnemonic. Only one thing: P equals push. P equals push. The other is just inward. Wherever you have the oncotic pressure, is just going to increase the fluid over there wherever it is increased. Okay, so that's one of the thing to know. Other than that, let's just quickly read. JV equals the net fluid flow equals the KF, which is the capillary permeability to fluid. PC again, hydrostatic capillary pressure. PI, hydrostatic interstitial pressure, minus the this thing. I don't know what this thing is, but whatever this is the reflection of the coefficient. This is a coefficient, and oncotic capillary minus the oncotic interstitium. Okay, so this is the in the capillary fluid exchange. This is the equation for it. Other than that, let's talk about edema. Important thing. Edema is excess fluid outflow into the interstitium, commonly caused by when you increase. So now just think about what would cause increase in fluid in the interstitium. One thing is when you increase the PC, that's going to push it out. When you increase the oncotic I, that's going to just grab more fluid towards itself, right? And that's it, right? So when you increase the PC, you're causing that. Or when you're increasing the oncotic, you're doing that. But on top of that, there are two other factors. Increase the capillary permeability by increasing the KF, which is the capillary permeability to fluid. You will still increase the interstitial edema. And the last one is about when you decrease the plasma proteins. Let's say you're decreasing the plasma proteins within the capillary. That will also lead to the fluid is going out. Seen in your nephrotic syndrome, liver failure, protein malnutrition. And this at the bottom, I think the way I explain is way easier than looking at this and trying to understand this thing. And just remember that this is the equation, and that is all for the capillary fluid exchange.